Thank you and welcome for being here at Community Health Assessment 101, Building Relationships for Wellbeing. My name is Mary Montel. I'm going to be the moderator for today. I'm going to go over some Zoom housekeeping rules to make the experience the best for all of us. Alrighty, so please go ahead and keep yourself muted when not speaking. We welcome you to have your camera on, but if it does affect your bandwidth, speed, and your video and audio, don't feel pressured to have your camera on. Go ahead and please use the CVent website to log in. And then you can also use the Zoom Q&A portion here. We'll also have some polls and we'll send links throughout the Zoom chat here. If you lose connection to the Zoom meeting, please feel free to try and reconnect. But if you have any problems, we can provide a call-in number. As a special reminder, there is a session evaluation form available and an overall evaluation for you to complete. And we aim to make this a great experience, and we do appreciate any feedback you have to give us. Alrighty, so I will now start by introducing today's speakers. Our first speaker is Alina Kawe. She's the president and CEO of the Red Star International. Alina is a national leader and advocate of Indigenous health with more than 25 years of experience working in partnership with with communities to transform ideas into action. In 2018, she received national recognition for developing the first public health institute in the US to focus solely on Indigenous well-being. For the last decade, Alina has focused on building public health capacity and public health accreditation readiness among tribal and Pacific Island public health systems in the US. More recently, her focus has shifted to exploring the role of governance in promoting the well-being of humanity and environment. Prior to Red Star, Alina served as the Pasquale Yaqui Tribe Education Director and as the administrator of the American Indian Research Center for Health at the Intertribal Council of Arizona. Alina is an enrolled member of the Texas Band of Yaqui Indians with cultural ties to Pasquale Yaqui Tribe in Old Pasquale Pueblo in Tucson, Arizona. She also has a master's degree in public health from the University of Arizona. And we also have here with us Teresa M. Carino. She's the senior project coordinator for Red Star International, where she works with the tribes and tribal organizations in the areas of commercial tobacco prevention cessation and community wellness, including the relationship between the environment and our health. Teresa is the co-author of the workbook More Than 5 A's Implementing a Commercial Tobacco Cessation Intervention in Tribal Communities. She has a master's degree in multicultural education and is a former high school administrator, teacher, and public health educator. Prior to working with Red Star, Teresa was the principal of a charter high school for the Pasquale Yaqui Tribe in Tucson, Arizona. Her 20 years of work in educational leadership and public health serve as a foundation for her ongoing work in our tribal communities and beyond.
Great. Well, thank you, Mary Frances, for the introduction. It's an honor to be able to participate in the Southern Plains Tribal Health Board 2022 Tribal Summit. Welcome, everyone, to the Community Health Assessment 101, Building Relationships for Wellbeing training. I think I just need co-host to be able to share my screen with everyone. Give us
one second while I get that. Yeah, work that. 1 second.
Thank you. Okay, there we go. Oh. Now, there we go. Okay. All right. Okay. Does that look good, Teresa? You see the PowerPoint? Okay, awesome. Well, we're excited to be with you all today and hope to have an interactive session on the key elements to assessing a community's health. I want to thank you for your patience for our late start today. It's wonderful that we can all come together in the virtual space, but it does come with its technical challenges from time to time, so I appreciate you all being patient. But we'll go ahead and get started. I thought I'd just share a little bit about Red Star. We're an Indigenous-led nonprofit organization whose mission is to advance Indigenous self-determination for the well-being of humanity and the environment. And we do this across these three focus areas. We believe our communities know the way forward and that collectively we have the power to heal the systems and power structures that perpetuate the inequities experienced by so many of our communities. And we believe that community health assessments are a tool that tribes can use to build the relationships needed to plan for health improvement and transform systems. You've all had a chance to meet us through Mary Frances's introduction. I'd also like to just introduce Chris Rhodes, who's on with us as well and is part of our team, and she'll be participating with us today. And so I know many of you have already put your name and title and tribe into the chat, but if you haven't yet, please do so. It just gives us a better sense of who's in community with us today as we move into the session and start having more conversations together. So just quickly, our session is really intended to provide an overview of the community health assessment process and how it helps to build relationships. We'll discuss the readiness to conduct a community health assessment, or a CHA. You'll hear me use the word CHA for the acronym often. How to engage leadership in the importance of data sovereignty and thinking about data use as you go through the process of conducting your CHA. We'll share some strategies and tools on how to facilitate a tribally led and supported CHA process, and then talk about how the CHA process can be used for health priority setting for developing a community health improvement plan. So where I like to always start is acknowledging Indigenous peoples as the original architects of systems or ways of life that kept us healthy. And these traditional life ways include our foods, our connection with the natural environment, our traditional games, our healing practices, all of which promote our physical, emotional, and spiritual health, our medicines, our intergenerational relationships, and our traditional practices, all of which kept our communities healthy and resilient. And so when I talk about systems, what do I mean? And I often look to this rosette as a metaphor for understanding systems, because it's more than just the individual beads, but how they're sewn together to create this beautiful pattern. And I think in that sense, it represents the relationships and ways of being and the processes that we use and how we interact that really makes that interconnected whole. And so how I was taught was to always have the vision in your mind of what you're going to be, and then to always have good intentions and good thoughts as you begin to string the beads together. And so this is really similar to creating change in our tribal systems. And so when we think about our Indigenous systems and ways of life, what happens when those systems are interrupted? How does that impact our health? And how does it impact our health today? Forced assimilation policies essentially dismantled those systems which kept us healthy. Education was removed from our homes. How we lived was changed from communal living to individual allotments. We experienced bans on our traditional practices. Many of us experienced disconnection from our land. Our health and well-being and our healing went from being a way of life to a Western model of healthcare. And so when we talk about our health and well-being today, we have to think more broadly than just about our hospitals and clinics. We also need to recognize that it's more than just the presence or absence of disease or what we do or don't do as part of our day-to-day activities. We need to think about it more broadly. And so I'd like to share this model from Margaret Greenwood that she created in 2015 for the social and cultural determinants of Indigenous health. And this model comes from Canada and is a community-centered model that puts children, families, cultures, and Indigenous nations at the center. And to understand the factors that determine our health, we need to recognize and acknowledge that our communities interface with non-Indigenous structures and systems. And within those interfaces, our communities experience the impacts of colonization, marginalization, and dislocation. This in turn has a direct impact on the determinants of health, which are listed on the left. This includes our early life, our education, employment, housing, etc. But tribes are in a really unique position to be able to ensure that our systems, our services, our processes, our relationships, and policies are aligned with our values and worldview. So understanding these determinants and their interrelatedness is important when we begin talking about conducting community health assessments, because we want to do more than find out how prevalent certain diseases and illnesses are. We also want to try to understand some of the root causes so that we can think strategically about community health improvement solutions. I really like this graphic from the American Indian Cancer Foundation. And while its focus of this particular graphic is on healthy eating specifically, it provides an aerial view of a community and shows all the different places and partnerships that exist within a community that are working together for wellness. Engaging multiple partners representing different perspectives from across the community is really critical to ensuring a comprehensive community health assessment that incorporates those perspectives and understanding a community's needs and assets. And so this is really good public health practice when we think about it broadly like this. So when we talk about public health, we're really talking about more than just our efforts to promote or prevent disease, but the various activities that we do that aim to provide the conditions where people can be healthy. So again, unlike healthcare that focuses on individuals, public health focuses on entire communities and how different partners and stakeholders work together to improve health. Community health assessments then are a tool for us to understand what activities are needed to improve those conditions and how we can work together to ensure those healthy conditions exist for our communities. So what is a community health assessment? Well, the development of a community health assessment involves a systematic process to collect data and information that provides a sound basis for decision-making and action. In order to alleviate health disparities among many of our populations, the community health assessment gleans data and information to help understand the factors and root causes that contribute to higher health risks and poorer health outcomes. And ideally, this information is used to inform strategies and plans to enable community members to attain their optimal health. The CHA can help frame a narrative to emphasize the conditions that create health and those that cause disparities. So it's important that a CHA be developed by the community for the community. And for this reason, it is important that community members and organizations are included in the process and that the key findings from the assessment are shared in a way that they can also understand and take action. Some of you might be interested in learning about community health assessment because it is a requirement for public health accreditation. So I'm just going to touch on that briefly so that those of you who are here for that reason can see the connections between CHA and the public health accreditation. So the Public Health Accreditation Board, or FAB, as it's often referred to for short, is the accrediting entity for governmental public health, and that includes for tribes, state, local, and territorial public health departments. And the vision is that our national public health system be one that is high performing and supports all people living their healthiest life. And so FAB recognizes that CHAs are good public health practice and that they are foundational to strengthening the work of governmental public health. So just briefly again, how CHAs relate to public health accreditation is they have set the national standard for what a community health process should entail, community health assessment process should entail. The foundational capabilities found in the lower part of the framework in the blue boxes represent the capabilities that all governmental health departments should strive to have in order to support those conditions to keep communities healthy. And so the CHA is the first one listed as foundational to achieving health equity. Accreditation looks at how public health systems work together to improve health. So imagine your own tribal public health system. Think about all of the partners who work together and who have the community's health at the very center, at the very heart of what they do. For each tribe, those partners look different. They have different roles and functions, and a lot of that has to do with the capacities, resources, and relationships. So with this diagram, we're just showing that tribes may have different relationships with their health departments and clinics, federal agencies, private industries, the tribal epicenters, tribal colleges in some areas, or mainstream universities. Whoever the stakeholders are, again, recognizing they all look different, when we talk about tribal public health systems today, we're really talking about all the partners and how they work together in your community. And so the 10 essential public health services represent the essential activities that tribal public health systems can implement for health communities. And this framework was created in the 1990s and has evolved to provide a framework for public health that is also centered around health equity. And you can see that assessment is at the very top, because assessment results ought to inform the work we do to improve health. So when we think about accreditation, we're really looking at how our tribal public health system partners work together to implement those 10 essential services. And this is often referred to as public health performance. So how well our systems are performing these essential services. And so that's why for accreditation and looking at a successful community health assessment, you'll see that assessment is the very first standard in the very first domain in the very first foundational capability within the FAB framework. That's how important it is. And so having the multiple stakeholders involved is a requirement for accreditation, but it's also a requirement to ensure a successful assessment. So community health assessment, sometimes referred to as a tribal health assessment, is one of 3 foundational processes. Together, these processes help a department understand the community's current health status, some of those root causes experienced by the community, and then health departments can use that data and information to create measurable improvements through a community health improvement plan. And then finally, the department's strategic plan can outline the infrastructural goals and areas for development to support those improvement efforts and have a positive impact on the community. So just quickly, these are some of the requirements that FAB has set as the standard for community health assessment. So having participation from various sector partners in the tribal community, so health, education, housing, law enforcement, and others, that the process engage them throughout, that you collect data that's broad-based, including both primary and secondary. You'll want to include demographic information, challenges experienced by your community, health status and behaviors, also a description of the inequities, including the social determinants of health, which I talked about in the beginning of this presentation. I'll talk about a little bit more later. The built environment, the natural environment, as well as all the community resources that can be mobilized to address these issues. And then there needs to be documentation that the community health assessment has been shared and distributed to partners and the community. So why is this all important? Well, it's important to first recognize that a community health assessment isn't just an outcome, it's a process. And that provides the foundation for making data-based decisions and provides a baseline for making health improvements over time. So as you engage partners in defining the assets and needs, defining the priorities, you can't help but gain buy-in and support, so that ideally by engaging others in the assessment process, you can also keep them engaged in the improvement planning process and using the report, not just for the health department, but for the tribe as a whole, as the basis for making improvements in the community. But before a tribe embarks on a comprehensive community health assessment, there are a few considerations to make. First of all, it takes a good chunk of time. And if it's done well, it can take up to a year to 18 months, depending. What resources do you have to support the community health assessment? And that includes not just time, but staff time, any resources, financial or others, if you need to hire consultants to facilitate the process, or seek other resources or capabilities outside the tribe. Do you have the leadership support? Are you about to have an election? May not be the best time to start a community health assessment process. What are the protocols that you will need to follow within the tribe to make sure that people are aware that you're conducting the assessment and that there is buy-in and support? And then what is your motivation? What is the reason or the drive that you have to conduct a community health assessment? And so that's where I'd like to just pause for a moment, because there are a lot of different reasons a tribe may have for wanting to conduct a community health assessment. And so we want to take a moment to find out what is yours. And so we're going to break into small groups, and Teresa's going to help lead us into that. And when you get into your small groups, we're going to ask you to, each of you, to introduce yourselves. And then just share your primary motivation. There might be several motivations that you have, but just given our time, just share your primary motivation for learning about community health assessment today, or what question you hope to have answered today, and have a discussion about that. And then identify someone from your group to report out to the large group when we come back. And so we'll have about 10 minutes in our small groups.
Awesome. Alina, would you like me to go ahead and drop that quick poll before they go into their small groups about their knowledge of the CHA?
No, let's go ahead and just go right into the small groups.
Okay. Sounds good.
Okay.
And I need to get the co-hosting, I believe, from you, Alina.
Oh, okay. There we go.
Awesome. So that is, let's see. All right, here we go. All right, here we go. The instructions are in the chat. You'll be able to see them once you go into the breakout. Just have a couple waiting to join their rooms. Julie, looks like welcome back. We're still waiting for a few to trickle back in from the breakouts. Just watching those. We have a few probably just finishing up their conversations. We have, yep, just about 3 more waiting to come back, and they will automatically be. Here we go. All right. That's everyone.
Great.
Welcome back, everyone. We hope you had a chance to just introduce yourselves. And as Alina said, just talk a little bit about, what is your motivation for wanting to learn more about the CHA? So just really quickly, we'll hear maybe some overall themes from each group. So if group 1, if you have someone that just wants to share a little bit about your discussion.
Yes, my name's Alexis. I'm with the Southern Plains Tribal Health Board, and it was a pretty overall consensus that we all just kind of wanted to learn more about what a health assessment is, and like what information can be gathered and all the different steps to be taken.
Awesome, perfect. Joel, you're in the right place. Thanks, Alexis.
Thank you.
Yeah. Group 2, how about you all? And I think I see someone unmuting.
I believe I was in group 2. This is Janice Cravat with Southern Plains Tribal Health Board. And there was 2 people in my group, and we had one who was going through FAB accreditation, and the other just started a program. And so we were just basically trying to learn alongside myself just how to conduct a community needs assessment and to make sure we get everything that we need within that needs assessment. So if Mr. Fry, you want to expand on that, but yeah, that's us too. We just want to learn.
That's perfect. That's wonderful. And all 3 of you.
Yeah, thank you.
Go ahead.
I mean, I actually didn't respond earlier because I'm on my cell phone and I didn't remember what group I was in as far as the numbers. So I was just waiting for someone else to chat. But yeah, I mean, we just want to learn more about the assessment and the process, and really using this whole process as a means to really as a means to improve our public health infrastructure and well-being of our tribal members, but following the FAB accreditation process in order to give us a good roadmap to get there.
Excellent. Thank you. Yeah. And thank you for bringing that up about the room. So room 3, in case you're wondering, we have Brian, E. Sontain, Gary, Jan. We're all in room 3. So do we have a volunteer from room 3 just to share?
I'm from room 3.
Okay, great.
And I believe that we did a health assessment in 2021. So we're still looking at that. We're still working on the 3-year plan and trying to get grants going with that.
Nice. Thank you. And then we just have 2 more groups. Group 4, we had Alex, Amber, Mandy, and Sarah.
Okay, so my group, we had several people that wanted to just learn more about the process and increase the context for tribal health. And also we had a pretty mixed group, 3 of us, one from rural Oklahoma, one from the Tribal Health Board, and then another member that lives in California. So it was interesting to hear all the different perspectives.
Oh, nice. Yeah, that's one of the magic things that happens in the breakout rooms, is making those connections. Thank you for sharing that. And to round us out, we have group 5. Would you like to share?
Sure. So, hi, I'm Blake. I'm from the Southern Plains Tribal Health Board. And the general theme of our little breakout room was that a lot of us are here just to learn more about the process for CHAs in general, to get some programs off the ground to really get community engagement going. And then also one member is actually wanting to use a CHA to gauge the needs of a new wellness center in their area. So,
wow.
Yeah.
That's awesome. Thanks so much. Thanks everyone for sharing. What I'm going to do now is drop in a link to our presentation slides. And this is a Dropbox link. If you have any trouble opening it, please just send me a message directly with your email, and I'll make sure that I email those slides to you. And then we do just have a little quick interactive activity to get our mindset in the right place. I'm going to drop that link into the chat as well. So this is going to take you to a site that's going to create a word cloud for us, and it's asking for one word or phrase that just to describe what wellness means to you in your community. So if you follow that link, it will give you those prompts. And then I will pull that up and I'll share that word cloud once it's populated. It's a nice little visual tool for us visual learners. Let me go to that. Awesome, we're getting a couple. Right. These are beautiful. Still got some participants typing, so we'll wait just a little bit longer and then I will share. Really cool. All right. I know a couple of people are probably still typing, but just thinking about time, I'm going to go ahead and share, and you'll see it as it continues to populate. And as you know, with word clouds, if a word is given multiple times, the larger the word is. So many of you are thinking about connection and healthy. Tribal life ways, understanding.
What's really beautiful about this is that, kind of going back to the rosette and the having a vision in your mind, when you're conducting a community health assessment, this is really the best place to start, is with that vision of healthy community. What does my community look like when it's well? Because then with that vision in mind, and we start to look at, okay, well, how are we going to assess our community's health? We can then say, use that information to kind of determine where we are in relationship to where we want to be, relationship to that vision, so that when we understand our community's health status at a given point in time, because that's what a community health assessment is, it's a snapshot of health and well-being at a given point in time, that it helps us say, okay, this is where we are. This is the vision that we have for our community. So now we want to use that data and information to create plans to move us towards that vision. And so that's why this kind of activity that we've done here can be really helpful in, even for all of us, all coming from different communities all across the country. There are some really key things that we all have in common in terms of what we envision for our community. So thank you so much for sharing.
Wonderful.
So I'm going to share my screen again and bring us back to that presentation. Thank you so much for sharing your thoughts. Please keep that in mind as we move forward into the presentation. So when we think about a community health assessment, and it's important to remember, it can be as small or as comprehensive as we want. It depends on that motivation. If we're doing it for a program, it might be more focused. If we're doing it for accreditation, it might be more broad and more comprehensive. So thinking about that motivation becomes really important. But what we're going to talk about is kind of what the key elements are, regardless of how comprehensive it is. And I will throughout kind of tie in where there's FAB requirements and where there's not. And I think the beauty of community health assessment, even for meeting the FAB requirements, is it does leave a lot of space for tribes to be very creative, and not just tribes, state, local health departments, very creative in their process. And so we'll be introducing some strategies and ideas for engaging your community that I think tribal communities can really respond to and participate in. So as you start thinking about conducting a community health assessment, as I said earlier, it's a big endeavor and there's a lot of things to think about. And so, think about your tribe's experiencing conducting community health assessments. Sometimes it's good to just ask the question. We may or may not know whether community health assessments have been conducted in the past. Someone mentioned they did one in 2021 and they're continuing to update it. And that's actually one of the FAB requirements, is that once you conduct your community health assessment, and then once you have been accredited, they want to see that you're updating that community health assessment on a regular basis. So thinking of it as a living process that's ongoing. So what is your experience? Any tribe that has a Head Start programs actually do needs and assets assessments as part of their program. So there are things we can probably learn from our Head Start programs. Is there leadership support? Do they value the community health assessment process? This can be really important, especially as you start asking other departments potentially to share data. They may or may not, be as open if those relationships aren't established. So having leadership support can really help, but also understanding the potential risks and benefits of collecting data and sharing that data. We know that our tribal data can sometimes be used against us. So we need to be thinking about what those risks are, what the benefits are, and how we will navigate that process based on our internal tribal protocols, how we think about data, how we share data, how we use data within our community. Again, as I said, what resources are available to support that? People's time, financial capabilities. Do you have infrastructure internally, people who understand data, who can help support the effort? As well as IT, if you have to do data analysis. These are all things to sort of be thinking about, but also how will the results be used? So thinking about that as well. And I talked about leadership support, and some tribes, every tribe is different. So again, these are just some ways that leadership can be engaged. With some tribes we've worked with, they've gone straight to their tribal council and wanted a resolution supporting their community health assessment. And this was a way of informing the community at large. Hey, we're doing this. We're going through this process. We want to know your perspectives. We have the support of tribal council. Also in working with other departments within the tribe. Some have done internal data sharing agreements or MOUs, both within the tribe and with external partners to say, hey, we're going to share this data. This is how it will be used. This is where it will and won't be shared. What are the steps we're going to take to ensure that our community is protected? Those of you who have that research background, we know that research protections often focus on individuals, but how can we ensure that how the data is reported, we're thinking about our communities and not perpetuating stigmas that may exist? And again, how are we reporting? How will we go back to our leadership? How will we go back to the community and share what we've learned through the assessment process? So one of the first things you want to do is select a model. And there are a lot of models out there. These are the ones that FAB lists in their version 2022, and that's mobilizing for action through planning and partnerships. This has always been thought of as sort of the gold standard for community health assessment. You can find information on the on that model, or you can just Google that and you'll find lots of resources on it. But NACCHO, the National Association for County and City Health Officials, is the one that provides a lot of resources and tools for using that model. And then I'm not familiar with these other two that FAB recommends, but picking a model will be really important. And my guess that FAB has identified these models because of some of the requirements they have in their community health assessment. And so FAB is really interested in community health assessments that look beyond the tip of the iceberg. So it's more, again, than just looking at the presence or absence of disease, but actually going deeper on what's below the surface. So looking at the social determinants, different systemic barriers that might exist, any structural inequalities that might exist. And, and sometimes with our tribal communities, everything we do is about promoting equity. But we know that there are also some inequities within our own communities. And sometimes that's due to distances from services, other reasons why some communities might experience more challenges than others. How do we get to the root cause to understand why those differences exist? So the community health assessment process helps us kind of look a little bit deeper to the community and to understand what the challenges that they face. We worked with the Intertribal Council of Arizona back in 2011 to create a tribally specific community health assessment guide and toolkit. And so this toolkit does not address all of the requirements that are now in the version 2022 for accreditation, but it is an excellent guide that addresses the tribal context, and it includes a lot of templates and that communities can use for engaging community, it has a sample MOU for data sharing. It has a lot of tools and resources that you can use. So I recommend you at least take a look at the toolkit. And if you're working for accreditation, you can just compare it to the standards and measures to ensure that you're still addressing those requirements. But when we developed this toolkit, we did a review of all the tribal health assessment tools out there at the time, and we identified these key elements that existed across. And did you see that, Teresa? Are you able to share that link to the toolkit in the chat? So the key elements are to develop a plan. And a lot of times people just start gathering data. They just start gathering data for their community health assessment. But it's really important to actually, based on whatever model you choose, or if you do a hybrid version and draw from elements of different models, to really define that process, what the activities and tasks are going to be, when you're going to do it, by when, who's going to be responsible. You need to define the community that you're going to assess, and you need to think about how you're going to engage community throughout the process. And then, as I talked about earlier, once you have that vision of health, what indicators are you going to look at to understand the community's health status at that measure? So what measures will you use to determine the health status? Then what are your methods going to be for data collection and analysis? And then from that, set your priorities for health improvement and develop your plans for creating change. And again, reporting those results. It's so important when we talk about community engagement. So often we go out and we ask questions, but when do we actually go back and say, here's what we learned, and here's how we're going to use what we've learned to make improvements? So thinking about how you're going to report those results in a way that makes sense for your community. So a plan, let's see, here we go. As part of that plan, we really recommend that you create a community health assessment planning team, and I'll talk a little bit about that more. And then with the team, define that community to be assessed, get clear about what the purpose is and the need and the readiness. So we heard purposes while we're doing it for accreditation. We just started a new program, and so we want to tie our program activities to that. We're creating a wellness center, so we want to be able to use community health status to inform how that looks. These purposes should really drive how you conduct the assessment and what you begin to look at. You'll want to look at, when do we need to seek tribal support and approvals as needed? When do we need to go back and report to the tribal leadership? How are we going to engage community and when? And we're going to spend a good chunk of time after lunch talking about that. What are our data collection needs? Who's responsible for what in the team? Who else do we need to engage in the process? And creating that timeline. So developing that plan up front is really important. So creating that team, we recommend that you start with a small team of maybe 5 to 7 people. And these are the ones who are going to help lead the process. You want people on your team who have that leadership and that knowledge of the tribe. They may have some expertise on data within the tribe. Another person might have a lot of the relationships with community. They might have existing coalitions or advisory councils that you can mobilize and engage in the process. You'll want to consider diverse representation, but this small core team can lead the implementation of your health assessment plan, but they can also work with you to engage other stakeholders in the process. And you can, depending on the size of your tribe, form work groups as needed. So you can have a work group that's focused on engaging community throughout the process, those people that have those relationships. Then you can have a work group on data if people who understand data or who have data to share and contribute. You might have others who are good at data collection tools. And these may be people both within the tribe, outside the tribe. Remember, thinking back to your tribal public health system, this is a way that you can engage them more broadly. But ideally, as you're engaging people in this process through the team or through work groups, that they have some skin in the game, or they've got both moccasins into the process and they're committed to seeing it all the way through. And so by doing this collaborative process, you can't help but build skills, because one, you're achieving some shared goals and desired outcomes that will benefit not just you who's trying to conduct the assessment, but also them who can also use the data for their programs and services. You start to learn about each other's capabilities, and you start to develop a shared investment in the planning and conducting of the community health assessment, and hopefully achieving those goals. So strategizing together, you begin to make decisions. Group decision-making becomes easier. You learn what works and what doesn't. And you have the opportunity to really acknowledge and celebrate each other's successes. And so if we think about community health assessment as a process resulting in perhaps a report, you're also continuing on and continuing to update and use that information and keeping folks engaged all along the way. So we've always talked about the importance of defining community in this process, and it was great to see that FAB has actually included it in their standards and measures. And the reason it's important is because you need to define who the community's health status is that you're going to assess. So what it does is it helps set parameters for the data collection, and it'll help you identify who the primary beneficiaries are of your health improvement efforts. It will also inform your community engagement. So when we say, well, who's the community that needs to be engaged, your definition will help provide that. And it supports accountability and reciprocity in the information sharing and reporting. So there's a lot of ways that we can define community, and it should align, for those of you that are pursuing public health accreditation, with how you define it for the tribe. So you may use geography. So all those living within a geographic boundary, like within the bounds of the reservation, which may include not just your tribal members, but spouses, children who may or may not be members of the tribe. You might define community by all those who are served by the health department or clinic. There's a lot of different ways that the community can be defined. But once you set that definition for the community health assessment, that will guide the assessment process. But again, for those of you who are applying for FAB, that community should also be the community that is served by the public health entity that's being accredited. And then you also want to think about the audience who's going to be receiving this information from the community health assessment. Is it going to be the same as how you would define community, or is it going to be more broad? And that will also help you in your planning. So once you have your model that you're going to use, you have your team and you've identified your purpose and the community that you're going to assess, then you start to define your process. So again, what are the objectives? What are we hoping to achieve? What will the process entail? Who and how are we engaging communities? We're going to collect data, but how do we ensure community voice? How do we can collect the data, but how do we make sense of that data? So sometimes sharing the data with the community, they can have interesting perspectives on what that data means that might be different than your own working for the tribe. And then again, how are you sharing your results? Who in your team or your broader participants, who's responsible for what in implementing these things? How long will it take? Get your timeline set up so that you can kind of have a sense of when things should be done. And then how will we know if we've achieved our desired outcomes? And this is important because we want to make sure that we are all working in time. And this will help ensure clarity to the process. It helps avoid finger pointing. It helps ensure that the responsibility for the community health assessment isn't falling all on one person's shoulders. It really should be a collaborative process that is done and supported by all. So when we think about, so I've talked a little bit about the planning process. Now let's talk about data, and I want to talk about it more broadly. We have strong oral traditions, and if we think about data as storytelling, as being able to help us tell a story about our community's health status at a given time, then it becomes a powerful tool, because good stories compel people to change. And so if we can use the data to increase understanding and to help us understand both what our challenges are, but also what our opportunities and assets are to be able to move things in a positive direction, it can change the way people feel, think, act, and behave, so that we understand that traditionally we are all responsible for our own health, and as part of a contribution to our whole health as a community. So thinking about how we tell that story, that's where we can be creative and not just sort of follow a Western model of this is how many people have this illness or that illness, but we begin to understand all the different aspects of our health. So we can look at positive aspects of our health. How many people are saying that they're exercising or eating well? What are some of the assets and resources that exist in our community? It is important to understand health status and the presence of illness and disease, because it helps us understand where we need to focus. But what are the attitudes and belief systems that our community members have? What are the behaviors? What are some of the risk and protective factors, issues, challenges, again, diving into those root causes. So I'm going to talk about each of these a little bit more. So these are some of the major categories of health that community health assessments often look at. So we have our demographic information. This is very common, age distribution, how many people speak the language, things like that, to just kind of describe our population. What are some of the socioeconomic factors? What are education levels? What are common household income and so on? Do people have appropriate housing? How much illness? We can look at new cases, prevalence. This is one way where we can say, why are we seeing a spike suddenly in STDs in a particular population? And, making sure that we're looking at things, there are priorities that the community will tell you, but there's also remembering those priorities that we know our communities don't talk about. So making sure that we're thinking about illness, not just the ones that we talk about, but also those ones we don't often talk about. And what is that distribution? I talked about that, whether we're seeing it more in females or males or non-binary, certain age groups, different villages might be experiencing different environmental contaminants. Why are we seeing a spike in cancer? Understanding these different things in our communities. What are different health conditions? You can take a sort of disease-specific approach to understanding different conditions that might exist. Remembering mental health and behavioral health, unintentional injuries, remembering our maternal and child health, having a healthy start, we know will help improve things for the future. Thinking about our end of life, what are some of those main causes? What are those distributions? Is there late diagnosis? Are there things that we can do through early diagnosis, be able to reduce our mortality rates through screenings and other prevention methods? What are some of the behavioral factors? Again, what substance uses are being used? physical activity, nutrition and diet? Are we using our seatbelts? Are our roads safe? All these different things that can impact our behavior. But also our quality of life. How does our community define a quality of life? Do they have childcare to be able to go to work? Are they working 2 jobs? Do people feel safe? What are the crime rates? How satisfied with the healthcare services are they? Is that a reason why they're not getting the healthcare they need? Transportation is a big issue. All of these can contribute to the quality of life. Then there's issues and there's things we can look at in the environment, both the physical and natural environment, as well as the built environment. Are we being exposed to pollutants indoor and outdoor? Are there vectors such as Rocky Mountain spotted fever through ticks or mice, the hantavirus? Do they have access to recreational facilities? Will a wellness center really make a difference in some of the activities that our communities are participating? Can they get healthy food? All these different things that exist. And then those attitudes and beliefs, and connection was one of the big ones that showed up in our word cloud. Do people feel a sense of connection, strong cultural identity, community and family connection? Are there intergenerational trauma, historical abuse that families are dealing with? What is the stress? Are they in survive or thrive mode? Do they feel safe? Again, hopeful or hopelessness. There's all these different things that can impact our ability to be well. Do we believe we can make a change? If I have diabetes, do I feel that I can take control of my health and eat better and exercise and improve my blood sugar and, or hypertension? What are the things that people believe about their own health? And then looking at some of those risk factors, like smoking is a great example. It increases our risk. So it is a risk factor for increasing our risk for asthma or cancer. What are some of the protective factors that can help reduce a person's chance of disease, like eating healthy and exercise? But also remembering those social determinants of health, which I've been talking about throughout, which looking at the social determinants of health is a requirement by FAB for your community health assessment. And so here are some examples of social determinants of health that you can look at. So coming back to this sort of model that we started with, looking at all of these different factors can be helpful. And so conducting a community health assessment, the possibilities of collecting all amounts of data and how you collect it can be overwhelming. And it can also be a little bit tricky because many of us come into this work, deep in our sort of circle, and we can't see the forest for the trees, as we often say. And so when we conduct a community health assessment, we really want to sort of rise out of the day-to-day and get that bird's eye view of looking at our community as a whole. And then we can start to see things a lot more broadly. And I want to share this example from the Swinomish tribe, because it takes that forest view of their community when they identified health indicators. And their indicators are very much tied to their connection with their land and with their lifeways. And so these are the things that they've identified as being important for assessing the health of the community. Are they resilient? Are they culturally connected? Do they have resource security? Do they have community connection? Is self-determination being exercised? And education is really important. And if you Google Swinomish Indigenous health indicators, you'll be able to see that within each one of these, there are indicators that dive even deeper. And so thinking about these topics more broadly and in a way that's aligned with your tribe's values, worldview, and things that are important, then you're going to gain that broader buy-in from other departments within the tribe, your community partners, but with the community itself. And this imagery is something that any community member from Swinomish, sorry, get tongue-tied here, can look at that and they can connect with it and say, I know what this means in terms of what it means to be a healthy member of this tribe. So when we think about data and the Indigenous data sovereignty is often comes up when we talk about this. And this is the right for our tribal nations to govern the collection, the ownership, and application of its own data. So sometimes when tribes conduct community health assessments, they can sometimes use external partners to work with them. And that is the tribe's right to do that. But it's also important for a tribe to consider its inherent right to govern its people, lands, and resources, and that includes its data. And so data sovereignty is also recognized by FAB in the community health assessment requirements. So what that means is that, because I've talked a lot about reporting the data and sharing it with others, is recognizing that a tribe has a right to decide what data will be shared and what data won't, how that data will be shared and with whom. And so when we think about community health assessments, we're collecting that data. We want to always be mindful of our data sovereignty and how that data is used, how it's collected, and how it's shared. So remembering that as we start to look at the different types of sources of data that we might collect. So for FAB, you are required to have both primary and secondary data. And to be honest with you, I am not a data expert, but what I can say for community health assessment, the thing that we need to know and just understand is that we do want to collect primary data, and that's data that's gathered firsthand by the tribe. So information that's being collected specifically for the community health assessment. And ideally, when we look at what data we have available to us through our electronic health records, our program data, and secondary data that's collected by others, like we might use state level data. The tribal epicenters have access to a lot of data, CDC, cancer registries. We might be collecting all of this data that we might look at it and say, what's the story that's not being told? What do we need to be asking our community members to be able to understand why these health issues are occurring? And that's where we can use a variety of different ways to get community voice into the assessment. So here are some examples. You can do surveys. Some communities like our tribe, community forums are the best way for us to engage our communities because we have central gathering places. And so conducting forums is a great way to find out, what does wellness mean to you? What are the priorities? What are some of the biggest challenges you have to accessing healthcare? This is how you bring community voice. You can do focus groups or talking circles or any way where you're doing group interactions to learn those perspectives. You can do individual interviews, windshield surveys where you drive across the community and look, where do you see health or where do you see things that may be negatively impacting health, or community photo submissions where you have the community take pictures of what does health mean to you in our community, where do you see it, and have people submit photos. This is a great way to engage communities and get diverse perspectives. And then there's secondary data sources that you can do. And I mentioned some of these from other tribal departments. Tribal Epicenter, you have your state statistics, federal, IHS, CDC data, census data, even from your schools and nonprofits. These are all different sources. So ideally, once you've identified what data indicators you want to look at, what gets a little bit tricky is what data is actually available. And this is where we sort of enter the matrix. And again, for those of us, some of us are like, is it Neo, where we're trying to figure it all out? Some people have that expertise, but there might be data that we really want, but is it available and is it quality data? And then thinking about what health issues are the priority. And so it gets really tricky when we're trying to prioritize what data we're going to collect, because again, we could do hundreds and hundreds of indicators. And so thinking about what might be the priority is to use our values. So what is most important to the community, or we can look at what's the urgent, we can use urgency, what's the most serious health issues, what are the health issues that are affecting the most people in terms of the size of population? Do we want to look at things that we can actually control or impact? Or do we want to look at where can we make the most significant impact in the shortest amount of time? And so these are the different ways that we can think about priority setting, but we're going to do a priority setting activity in just a little bit. But I want to pause and see if there are any questions. Mary Frances is going to share a little bit more about how the Tribal Epicenter can help and support the data portion of your community health assessment. But I know I've talked a lot, so I want to stop, see if there are any questions. Again, Mary Frances will talk about tech resources, and then I'm going to take you through an activity that you can use with your community to priority set. So for your questions, you're welcome to drop them into the chat, or you can just unmute and
Chances are, if you have a question, 3 other people in the group have that same question.
So I think what we'll do is we'll go ahead and Mary Frances, I'll go ahead and turn it over to you to talk about the tech resources that are available. But I encourage anyone who has a question, you can put it in the chat or you can send it directly to me, however you feel most comfortable. But Mary Frances, I'll turn it over to you.
All right. Thank you, Lee. Appreciate this time to talk about the services we offer here at SBTHB. So I've introduced myself as a moderator, but I'd like to reintroduce myself as the position I have here at Southern Plains. I'm the Tech Fee Program Manager. Tech Fee stands for Tribal Epidemiology Center Public Health Infrastructure Grant. And just kind of like the title alludes to, we are all about building internal capacity and infrastructure. And so we're able to do that through our technical assistance services. Technical assistance is a jargony word, and we often refer to it as TA, but really what it is public health program assistance. In the context of CHA, what we've done before and what we have the capability to conduct now will include, we can offer assistance in finding the appropriate model or survey tool, just like Alina talked about. You know, if you need assistance with that, we can absolutely do that. We can help edit and customize the tool depending on what your community needs are. We can assist with creating and designated virtual storage data management workbook. So data is kind of our bread and butter. So when you were talking about the matrix, my eyes kind of lit up and said, we can absolutely help with that. We've got epidemiologists here. We've got biostatisticians. I myself love working with data and can whip up a code book if that's what's needed. And that'll help with housing this data, you know, recording what the original survey tool was. It can help with entering responses, cleaning that data. We can also help with analyzing the data that's already been collected. If there's kind of like a hiccup there, we can absolutely help there. And that includes doing any qualitative or quantitative analysis. We have the capabilities to do both. And we can also assist with reporting. You alluded to, depends on who you need to report to. We can create synopsis and really try to see what was actually captured. We can report to specific audiences. we can report back to the same community that the, community health assessment was conducted in. We can report to tribal leaders, to public health staff, to funders, so on and so forth. Depending on who you need the report, we'll customize it to that. And that's all for primary data. We can absolutely assist with that. And at the same time, we have the capability to assist with acquiring secondary data. You've mentioned a few, US Census data, cancer registry, the BIRFIS. And we're used to dealing with smaller numbers when we're looking at data because we're trying to make it specific to our tribal communities. So there's often a few caveats when we're looking at data. So we understand how to navigate that, and we can absolutely help with that. And lastly, you made a very important point about respecting Indigenous data sovereignty. And when we enter in a collaboration with anyone, whatever they've stipulated that they want us to handle the data, whether that's in treating the data and housing it or even destroying it, we will absolutely oblige to what they have stipulated. So if there's any more information or you have any questions about our technical assistance services, we've put a TA video on the CVent website, and at the same time in our Southern Plains Tribal Health Board, which is sbthb.org/technical-assistance. There's a form there if you wanted to go ahead and fill one out, or if you needed some more information, you just want to shoot out a question, you can do tahelp@sbthb.org. I'll put that in the chat, or you can email me and I'll put my email as well in the chat. Thank you, Lena.
I forgot I muted. Thank you, Mary Frances, for sharing that. Tribal epicenters are a great resource for conducting community health assessments. So please reach out to your tech in your area. Any questions before we go into an activity on how? So we talked about all the different health indicators that are possible, but how do you narrow it down for your community health assessment? And feel free to drop questions in. So I'm going to go ahead and go back to my PowerPoint. It doesn't look right. Did I share right, Teresa? Nope. Okay, let me try again. No? Okay. So it's hard to, and even using the word prioritize is always hard in our communities because it's all important. All of it is, our wellness is important, our illness is important, and we can't say that one thing is more important than another. And so that's why when I talked about a little bit earlier in thinking about, when I was talking about the data, about sort of priority setting, if we can communicate to the community how we selected these issues can be important. And so we often when we talk to tribes about priority setting is more of, this is what we're choosing to focus on at this point in time, recognizing that there are it doesn't mean we're not working on the other health issues, but these are the ones that we're looking to understand more deeply at this time. So figuring out how to communicate in the community is, again, not saying this is more important than another, but this is where we're starting with our assessment. And so I want to introduce this tool, and some of you may be familiar with the Affinity Diagram, but what it is it's a tool that is great for working with large groups, for gathering a lot of ideas, grouping them into sort of category, and it allows people to generate a lot of ideas and be able to identify themes that just naturally emerge. And it can encourage sort of thinking outside of the box. And it also allows individuals to contribute and have equal voice, while also seeing what some of the group themes, kind of like the word cloud, those things that bubble up to the surface that many people are thinking across. And so by doing that, if everybody has an opportunity to brainstorm and contribute, it increases their ownership in the outcome and the result. And it helps overcome sort of that paralysis of, oh my gosh, we could look at all of these different things. Where do we even start? It helps narrow it down and make it more manageable. And so we're going to do an activity, and the affinity diagram is something that you can do in person, but with our new realities of working in the virtual space as we are now, we're also going to introduce a virtual tool that you can use, and some of you might be familiar with Jamboards on how to use the affinity diagram. So what we're going to do is we're going to break into 2 large groups. We're going to just brainstorm health indicator ideas. What do you think, just from your perspective in your community, what are the measures that we need to be looking at to understand our community's health? And we're going to brainstorm. And when you do the affinity diagram, what you do is you put one idea on one sticky, and you just come up with as many stickies as you have ideas for understanding health status. So this is what it looks like in action when you're in person. So with this particular group, we were working with about, I would say 60 to 70 people, and we were putting these stickies in different categories around the room. And so what we're going to do is put our stickies out using Jamboards, and I'm going to have Teresa demonstrate that in just a second. And then once we've put all of our ideas out, again, just brainstorming our stickies, our virtual stickies, then we'll work as a group to start putting them into themes. And so you can see with this particular group, we had a whiteboard. They grouped all the stickies into the groupings that they thought, and then they named each of those groupings. And so we're going to go ahead and go into our activity, and Teresa's going to show what it looks like in the Jam.
Yeah, so if you're not familiar with Jamboard, don't worry. One of our team members is going to go into the breakout with you. We'll drop the link to this Jamboard so that everyone can interact. So right now we haven't shared it yet, so you can't interact yet, but you will be able to. And so once you go to this Jamboard, you'll come over here to the side and you'll pick a sticky note. And you'll just, type your health indicator. I put one here just as a sample, click to edit. So someone could use that one and write in there, right? Like,
diabetes.
I was just going to say, but I was like, I always use that one. So, and then, so you can go through, you can pick your color. They don't all have to be the same color. And so this Jamboard will pretty quickly get filled up with numerous little sticky notes, virtual sticky notes. And then we'll do that for 5 minutes. Don't worry if you have diabetes and someone else put diabetes, that's fine. Don't stop, don't erase, just keep putting the sticky notes, because then after 5 minutes together, you're going to start grouping them and you're going to see like, wow, 5 of us put diabetes. Wow, that must be. So don't stop yourself. It's free flow. It's anonymous. So please, just use those 5 minutes and type away. So I'll stop sharing here.
And don't worry if your stickies are covering each other's up either, because that'll happen as well. So the main point is to just brainstorm.
Okay, so I'm going to recreate these rooms. We're just going to have 2. And again, one of our team members will be breaking out with you. So here we go. You should be prompted. And then Alina, if you or Chris could go into group 1 with the Jamboard number 1, and I will be using Jamboard number 2, and I'll jump into group 2.
Okay. I just realized I don't have the internal agenda up. Oh, there we go.
Here we go. I'm going to join.
I'm in group 1.
Yes, please.
Okay.
Yeah, it's not letting me join. I don't know why. Is it because I'm like a And we're back. That was awesome.
Yeah, do you want to go ahead and go first, Teresa, and kind of share what your group?
Sure. Let me share screen here. So yeah, it took us a minute to get started, and then they just started coming, and they kept coming. And we had people grouping things like education access and graduation rates. So really talking about our language speakers. I'll pause for a minute too, though, just to see, because we got kicked out right when I was
us
we
too.
had to volunteer. Anyone from our breakout, please unmute yourself if you'd like to share. That would be great. But so yeah, we had a lot of like I said, different sticky notes, and we were just starting to group and move things around. But you'll see, like I was saying, education, health literacy, and health access. At the bottom here, depression, family issues, therapy, anxiety, mental health, suicide and opioid addiction. Up here at the top right corner, we talked about ACEs, drug abuse, social support or lack of there, right? Alcohol abuse and other substance abuses, obesity rates connected to screen time and nutrition. And we had nutrition again here. And here in the middle, talking about trauma, boarding school trauma, which is also related to language loss and language speakers. So
Awesome. I'll share ours. And we too, I mean, the thing is we could have talked, we could spend all day, a couple of hours doing this, especially with you have a large group. But as our group was talking about, and I think, again, we could have used more time, but this just gives us a taste of what it's like to jam with the Jamboard. And obviously, if you're working with your communities, you're going to do more than just a 10-minute activity. But one of the things that came out in our discussion was that all across, it was about access, whether it's access to care, access with education, access with testing and different things like that, transportation. I don't know if I said that already, but even that community sort of responsibility and care for themselves to access that care as well. So when you do community health assessment, it can also have access as being sort of the umbrella in which or the lens in which you look at community health, and then look at indicators underneath that. So these Jamboards or the Affinity Diagram can just help us sort of get to that place where we're getting community voice, getting community perspectives around what's important. And so we're just about to go ahead and break for lunch, but we have homework for you all. And so I'm going to pull that up. Hold on a second. So another activity we have for community engagement is, we talked about, and now I'm having trouble, now I can't find it, was community. Teresa, can you pull up your PowerPoint?
yeah, let me get it.
Okay, and pull it up to the homework.
Okay.
So we have an hour for lunch from 12 to 1 Central. And what we're going to do is invite you all to send us a picture of health. And so I provided an example from my home with my family, my husband's family. And this is right when we came out of a lockdown from COVID. The first thing my father-in-law said, let's bring the little ones together and let's have what they call a hongi, which is cooking the food in the ground, and we're going to teach them how to do that. So we have some pictures of us putting that healthy food into the ground and cooking it as a family. So you have three generations pictured here, and the healthy foods being cooked in a traditional way there in the ground. So they're standing there on the right, just above that. So send us a picture by 12:45 Central, 11:45 Mountain. You can either email it to info@redstarinTL.org. Whoops. And I just noticed there's a misspell in the email. It should be INTL, like international.org. My apologies. Or you can text it. We'll put it in the chat, the email. You can email, text it, or you can drop it into the chat as well. So 3 different ways. And the photos will only be used for this presentation, but we'll create a collage and show you an example for how you can do a picture of health for your community. So again, the email and number are in the chat, or you can drop it in the chat. Please do so by 12:45 in order to have it included in the activity when we come back. So when we come back, it's going to be all about community engagement. Again, we want to thank you for your time and hope you all rejoin us at 1 p.m. Central.
And no need to actually rejoin. If the room will stay open, if you prefer just to keep your camera off and stay muted. That way you don't have to look for the link again, and we'll be here waiting for you after lunch.
See you in an hour. And had some lunch. So again, this next section, I'm just going to quickly tie up the our last activities, and then we're going to go into purposeful community engagement and relationship building, and that will bring us home, for the remainder of the training. So glad to have you all back with us. I wanted to just wrap up by saying, we did the prioritization activity, and it was great for generating ideas and kind of showing where everybody's minds were around health and the community, and themes were starting to emerge. So, when you have more time to do the activity more completely, you'll start to see some really clear groupings, or you'll see themes that emerge. And those themes can help you then go through a process of identifying your potential data sources. And we shared earlier the Itca Toolkit. And if you go in there, there's actually a template in there for you to take the brainstorming ideas, work with your people who know data, and start looking at what the potential data sources are that can help you measure those indicators that you brainstormed, looking for both primary data sources as well as those secondary. Again, primary are any of the data that the tribe has collected firsthand or for purposes of the assessment. But it's also an opportunity to then, once you review that, check the quality of the data. Are there any gaps? Does it tell a story of the community's health adequately? Where might you be able to collect some additional data or context from the community to tell that wider story? So when you look at the data that you already have and look at, what do you need to learn from the community? In our group, we kind of talked about what is it, a little bit about how to get people to feel motivated to move towards a healthy lifestyle. Let's ask the question, and that's where this next piece on community engagement becomes really important. But going back to the earlier conversation around how much time do you have? How much is it going to cost to collect that data? What resources do you have in terms of staff? All of those things do become a driving force for how comprehensive your community health assessment can be. We worked with one tribe that actually got a grant specifically to conduct their community health assessment, and they used it to get community members to actually go door to door in the different communities and do and see who would participate in the assessment. So it can be that comprehensive where, and also depending on the size of your tribe, what's realistic, there's all different kinds of ways. But this is where you can begin to start narrowing it down, prioritizing, and developing your data collection plan. So once you've done that and the data is collected, then again, as I talked about, you then go through a process of going back to the community and share with them what you've learned. You'll want to seek their input on the interpretation of that data. You can also use this to get their input based on the data. What do they think is most important for the health department to be addressed? This can be through community forums, community meetings, social gatherings. You can even use social media to do quick surveys, provide links to the report. Once it's created, you can create a community health profile. Again, thinking about those approvals and your tribal protocols, the different ways you might disseminate it, whether it's by print, putting it on the tribe's website, or maybe it's an executive summary that has the data the tribe's comfortable sharing. It could be through emails, email listservs. We've done it where the tribe has held a virtual presentation like this and sought input. There's so many different ways that we can do that. So reporting those results becomes really important, and it's also an opportunity to continue to engage the community in the assessment process. So just a quick review, and again, I know this is really fast. Ideally, we'd have a whole day to work with you guys to talk about community health assessment, but these are the key elements. Picking that model and then developing your plan. What's your process going to be? How are you going to define community for the population to include in that assessment? How are you going to engage community? And we're going to talk about that a little bit more shortly. You're going to need to identify what the health indicators are going to be. How are you going to measure that? We've given some ideas on how you can generate ideas and prioritize what indicators you're going to explore. Create that data collection plan, what your methods are going to be, what are the gaps, how do you fill those gaps? And then once you have all of your data, begin to share that data with others and begin to prioritize which areas the health department or program is going to focus on. And then you want to share those results again with the wider community, with your leadership, however that looks. So we just want to pause for a moment, and before we go on to the community engagement, and just check in with you guys. Does anybody have any sort of lingering questions or even just comments about what we've shared so far? Points of maybe inspiration or ideas about how you might implement a community health assessment in your community?
I had a question. You had put some resources from FAB about how to select a model. And I'm wondering if there are any others that are specific to working in tribal communities, or were those kind of general?
Those ones are all general, and that's why the toolkit is the most current. Northwest Portland Area Indian Health Board had put one out some time ago, but I want to say it's been 15 years or more since that one came out. And now with all the changes with accreditation, the ITCA one is now a bit outdated as well. But that's only if you're pursuing accreditation. If you're not pursuing accreditation, the ITCA toolkit, the Portland Area Indian Health Board has one. I don't know if they still have it on their website. I haven't looked for a long time because it's been now the ITCA one, which we helped create, is our go-to and is our model. So it really is. And Teresa's dropped the link back in there. You can have a look at it. It's got so many templates and activity worksheets. I think it even has some instructions on the Affinity Diagram that we just did. So it really is the best resource that I'm aware of that has tribally specific guidance and considerations, recognizing how diverse tribes are and how diverse a tribe is going to be in how it conducts its community health assessment and all the considerations it has. So, all right. Well, we'll go ahead and Teresa, I'll turn it over to you to talk us through the community engagement portion of our presentation.
I was on mute. Can you see that correctly?
No, we're seeing the whole.
Okay. Okay. All right.
There we go.
There
Yes.
we go. Awesome.
Yeah.
So as Alina said, you want to first create the plan and define your population, define your community. But you also really want to have some guidelines, right? Authentic communication, authentic and meaningful engagement is rooted in the belief that we have a say in the decisions that affect our lives and our communities. It isn't just about sharing and decision making now in the present, but for future generations as well. And once input is given, there should be clear communication, as Alina has said along the way, around how the input will affect the decisions. It's an opportunity for us to reflect and take stock in ourselves, our surroundings, and our quality of life. So with that said, let's take a look back at the word cloud that we did at the beginning when we engaged you all to ask you to share a word or phrase to describe what wellness means to you in your community. So this was just a really quick, interactive and easy way that you can, ask your community. Right now, we're in community, a virtual community, and even through Zoom, you can engage people. Community engagement, it's like a buzzword, right? It gets thrown around, it gets used often, and it means different things to different people. It's important that we get grounded in a shared definition. Community engagement brings people together in a meaningful way for shared purpose. In the process, we are connecting and building relationships. Learning what the community wants. This leads to real and meaningful solutions and understandings of the issues in the community and fosters a sense of responsiveness, accountability, and trust. So now we want to have a plan, right? Before we go any further, we need to see, are we ready to engage the community? As Alina has said, we don't want to just go in without a plan. You have to have a plan for the plan. We want to make sure that we start. There are many questions when it comes to engagement planning. It's the who, the why, and the what. Who are we engaging and why? What is the outcome that we have in mind? And all of these things need to be taken into consideration, right? Who is that community? Who is that population being served that we are looking to engage? So it's important to look at the entire community. Throughout the trial process, you may engage different groups for different reasons. The community at large or community leadership, such as tribal council, coalitions, and other organizations. Or perhaps you want to hear from a specific group with shared experience, such as our elders, our youth, our cultural leaders, families, our two-spirit relatives, and people with special abilities. It's also important to consider the internal and external partners and stakeholders, such as other tribes that you might already be collaborating with, as well as local and state health departments, nonprofits, schools, and tribal businesses. So once we've defined the community that we're looking to engage, how and where will these conversations take place? Examples that Alina already talked about: community conversations, surveys, a photo collage with themes, which we did and will be sharing shortly. Thank you everyone for sending in your beautiful photos. And where and when will this engagement happen? Like at a community center, a cultural event, or as we're doing now and started because of the pandemic worldwide via Zoom. And really importantly, what value does it hold for the community? How will we share and report back to them, as Alina talked about, because there should always be a loop back to share results and next steps. And finally, what resources exist, funding, staffing, and time, because we all know that our days are so busy and we have competing priorities. So what time do we have in staffing to support the community engagement? So here are examples. We've talked about a few of these, but depending on your audience, you may have a formal presentation. I remember working with the tribe, and we would give presentations directly to tribal council. You may have an info table at a community event, a tribal health fair, and engage with surveys or questionnaires. To go more in depth, you could hold community forums and roundtables, or engage folks in a focus group or community circle. Social and cultural events are also great places to reach members of the community and gain diverse perspectives. When you engage folks through the CHA process, as Alina said, it is a process, and we want to engage folks at every step of the way. You build relationships and connection throughout the process. Your CHA will be that much stronger when you bring people together in a way that establishes trust or strengthens existing trust, which then allows you to gather information and gain understanding of one another's goals and aspirations, and identified shared values, interests, and even challenges along the way. How can communities support a CHA? When we engage the community in a meaningful way, the community defines what health and wellness looks like to them. You can go deeper and explore beliefs and behaviors about health, as well as barriers to health, like transportation to medical appointments, food deserts, historical mistrust, and more. Once the information is collected and categorized, you can use prioritization methods, like Alina walked us through earlier, keeping in mind that they are all priorities, they are all important. Then re-engage the community to further understand the data and get their input once again, keeping and continuing to have them engaged throughout the process. And finally, share the results back to the community and discuss next steps. We're always completing that loop and coming back to the community. So Lena shared this earlier. And when we look at this, when we look at about community supporting a CHA, we think about below the iceberg, right? And this is where we hear from the community. There are storytellers and the knowledge keepers. They help us look beyond the iceberg. This area below contains experiences, attitudes, and beliefs that help define and increase our understanding about the health or health challenges of the community. These stories are data, and I love when Alina talks about storytelling as data. So how do we collect these stories and this data in a meaningful and efficient way? Alina also shared this slide, but it's important to come back to it again. These primary data sources, community surveys, the community forums, focus groups, which we like to call community circles now, one-on-one interviews or key stakeholder interviews, and windshield surveys, community photo submissions like you all did today. And again, as Alina said, I am also not a data person, but it's important that when we look to these secondary data sources, that we look there to identify the gaps and then go to the primary data to fill those gaps. So here's the picture of health. We asked you all to submit. It's beautiful. Some of you submitted more than one photo representing different ways that you saw health. So engagement, this is an example of how engagement can be creative and personalized in real time. What are some of the themes? And you can either unmute yourself or write it into the chat. I cannot see the chat with sharing screen. So if someone else can monitor that.
Yep, I'll do that.
Perfect. What are some of the themes you're seeing throughout the pictures in the community collage? Feel free to unmute. Or in the chat. Resilient. Ooh. Nature. Oh, I can't see the chat after all. Access to traditional foods. Yes.
Fresh air.
Fresh air, right? You can like smell the fresh air in these pictures. Culture, clean water. Yes. Happiness. Different generations. Family. You're capturing so much, and some of you, even along with your photos, even gave a little backstory or a description if you want to share that. Those were some beautiful messages. I see effort to focus on the slower pieces of life. Ah, yes, Amber. Connection to the natural environment, family. Beautiful. Our future. That's amazing. Anyone else? Simplicity. Beautiful. I had a colleague who, her name is Keisha, and she used to say, I'm okay with uncomfortable silence. I'll wait. But no, these are beautiful. Thank you all for sharing and for reflecting and pulling out these themes that we're seeing. Healthy waterways equals traditional foods. Yes, Sarah. Amazing. All right, and so I will stop sharing here.
Was that it, Teresa? Or
Yeah.
oh, okay. So we've talked about a lot of different ways to engage community throughout the community health assessment process. And so if we come back to the slides that we shared earlier, and in particular this one, this graphic from the American Indian Cancer Foundation, is just the importance of remembering our community as a whole and how we're all working together in partnership to create wellness in our community. And this is really our public health approach. So when it comes to community health assessment, taking that aerial view of the community to get a better sense of all the landscape that is our health and wellness, but then also going beyond what you see and going below the surface to the root causes will help ensure that your community health assessment is reflective of the community. And then it's important to remember, while it may not tell the whole story, it starts to tell a story, and it does so in a very purposeful and deliberate way. And so making sure, and especially for those of you who are interested in accreditation, that not only will it, accreditation or not, by involving multiple stakeholders in the process of conducting that assessment, you are creating transformation across the 10 essential services. And that's the way in which we begin to transform our public health services. And so in thinking about all of that, I want to just sort of wrap up with thinking about the basis for community health assessment, reminding you all that it's a process, and it's one that even once you complete your first community health assessment, ideally you're updating it on a regular basis. It provides you data for you to begin to make data-based decisions. So it's not just based on what you think is important or what some of you and your colleagues think is important, but based on what the community has also provided. And once completed, it ideally will create that baseline. So as you develop your health improvement planning efforts, you can collect that data, say 5 years from now, and see how things have changed or have not changed. Engaging community throughout that process ensures that buy-in and that support and that investment, as well as the reporting. And for assessment, it really, in order for it to be meaningful, impactful, and that's why the motivation of it needs to be supported by everyone, your leadership and your community, because once you go into that improvement planning, you want people to be invested in the solutions as well. And so for public health accreditation, the community health improvement plan is sort of the follow-up requirement. And this falls in with domain 5, for those of you that are interested in that, where it also requires that broad participation from public health system partners. And you need to use that assessment data to be able to identify the issues, the themes, the assets and resources that can be mobilized by the different stakeholders to identify priorities and create measurable goals, objectives, and outcomes to make those health improvements. You will also need to look at what policy changes might be needed to support that. And then how do those priorities that the tribe has identified align with local, state, or national priorities? And so this is where the community health assessment effort becomes this living process that impacts planning. And then as you continue to gather data, you're able to also report back to the community, here's what we heard, here's what we're doing, and then through the plan and reporting of outcomes on the plan, and here's the impact that we're having on the community. And so, with that, that concludes our presentation. And I just want to turn it over to see if anyone has any questions or comments. And I think what we have time to do is to kind of just do a round robin of what your key takeaways were from the training, or what questions you still have. And so I'm going to just work down the list as you appear in my Zoom here. So I'm going to start with Laura. I'm not sure if I'm saying your name correctly. Laura, are you with us? Do you want to share something that you gleaned from the presentation today, or something you want to learn more about? Okay. I think somebody's unmuted. Jamie?
Okay, I'm on.
Yeah,
I was trying to find my unmute button. I'm not. But anyway, I think that every time I listen to one of these conferences, I just learn different aspects of community health, and definitely the tribal community health is very important because we're right here in the heart of Osage Nation. And so it's very important that I understand more about tribal government and the cultures involved there. But I love the pictures. I love the way you really made it personal. And it was a good training. Thank you.
Great. Thank you. Thank you for sharing. How about Dee Howard? Are you with us? Okay, we've got Amber shared in the chat. My goal is to be able to include and appreciate Native context into the community health assessment and the evaluations that I do. Thanks so much for sharing, Amber. Anybody else? Jamie, I see you're unmuted. Did you want to share something?
This is Gary Piercy from Southern Plains Tribal Health Board. I just want to thank you, but I love the toolkits. I think sometimes it's important to realize you don't have to reinvent the wheel, but you can start with processes that have already started. So thank you for what you've given.
Thank you for sharing. Okay, Dee Howard's mic isn't working. Is there anything you'd like to share in the chat? I appreciate everybody sharing things in the chat. Thank you, Chris. Anybody else?
Comment. Damon said, I
Yes.
obtained a clearer understanding of the process and how to get it started.
Excellent. Oh, yes, there it is. Thank you. Thank you, Damon.
Lena, if I could say something real quick, I think that this information that you guys are providing, it's very timely. We just kind of post-COVID, and I know that our communities, our demographics have shifted quite a bit, and it's going to take, a reassessment of, where we're at right now. I think our population maybe have gotten a little bit younger, perhaps, but I really appreciate all the information you've shared so far. Thank you.
Thank you.
Some more in the chat. Outstanding presentation.
Thank you. Anybody else wish to share some insights they gained today?
Hi, Lena. It's Lance Fry.
Hi, Dr. Fry.
Hi. I just want to comment on, I think you just really drove this home, but it hit me. Working when I was commissioner, trying to make improvements in rural areas, we really realized that, as much as we had good intentions, a lot of times we did things to people instead of with people. And, getting that community buy-in and involvement is just critically important.
Yeah, thank you.
Comment in the chat. Oh, go for it.
Yeah, Angela just shared, helps show how everything is linked. And I'm familiar with educating my patients, but it helps to see how this information can help with funding and working around potential complications in specific groups. And I think that's the part that's really important. You may remember the slides around the forest for the trees. And that sometimes when we're working with community, we're on the ground, we're working every day. But sometimes it's harder to see that bigger picture. And especially when we're trying to create, positive change, in beliefs and attitudes, but also in behaviors. And in fact, tomorrow we're going to be doing a training for how to conduct a commercial tobacco use intervention. that was designed for the clinical setting, but how do you implement it outside of the clinical setting? And again, there's so much to think about when we're working with our community members and thinking about the social determinants of health, that it's not as easy as just, start exercising, start eating better, quit smoking, all of these different things. We know that our people are living within this sort of broader context. And I think it's linking people to the culture, to activities, to positive health connections that can help create that change. But it takes time, and it definitely takes a community-based approach. And so that does take time to be able to do that. And that's why the community health assessment process and improvement planning can begin to move things in that right direction. And I think for public health accreditation, while it may not be for every tribe, it does provide a framework for thinking about how to be able to transform our systems from a more community-wide perspective. And so, yes, so we had a question about the session that we're doing tomorrow, and I'll just do a quick. It is tomorrow at the same time as our community health assessment, and it is called Beyond the 5 A's. So I'll put up the flyer for that tomorrow. Encourage those of you who are interested to participate. So we have another question here from Chris. Any suggestions on ways we can build capacity within tribal communities when we engage them and build long-term relationships? And I think this actually goes in line with what I was sharing about the accreditation framework and the foundational capabilities. And we talked about this at length in our training yesterday. And it was recorded, so I believe it will be available to participants to review, because what there really hasn't, when you think about public health, we really haven't had a framework for building our capacity in the past. And there have been great investments that have been made in local and state governments in building their capacity that goes back to the 90s. And for tribes, it's really only in the last 10 years, and mostly like really we've seen the greater investments like through Good Health and Wellness in Indian country and some of the other funding that's come through to really build the capacity of tribes in the last probably 5 to 6 years. And where before all the funding that was coming in was just real disease focused, like here's money for cancer, here's money for diabetes, here's money for this. And when we think about capacities, instead of putting money towards the health issue, looking at how do we put money towards our ability and our capacities to be able to address chronic disease as a whole. And recognizing that many of the contributors to chronic disease are the same. So being able to be more effective at understanding and collecting the health data, to be able to understand these issues, to be able to develop health improvement plans to help address the root causes as to why some of these issues are impacting our community. The public health accreditation standards provide a framework that any community, urban Indian health program, diabetes program, any program can look to it to kind of see what resonates and how they might be able to build their internal capacities to do that. And I think when we think about community engagement more broadly, like the way Teresa had talked about it, it's more than just coalitions and all of those are important, but how do we bring them along with us throughout an entire process of understanding the issues, coming up with solutions, implementing those solutions, reassessing to see how we've made an impact, where have we done well, where can we do better? And then it becomes this cycle of sort of reassessing and going through that process again. So those relationships are developed over time. There's that buy-in and support for what you're doing. These are the directions that we want to be able to move in and And that's why I think community health assessment can be so transformative.
We had one more comment in the chat from Sarah. She said, "Thank you for this presentation. It was meaningful to me. My takeaway is community is everything. Heal the community, the people equals heal the land, water, and air."
And it's so true. And I would add to that we also need to heal our systems. We need to, we have really strong clinics and hospitals, but we have a lot of things that are following that Western model. And there is a great deal of value with that. But how do we also create changes to evolve the way in which our systems operate to be more in alignment with our values, our worldview, and fostering that community and family connection as well. This is great. Any other sort of thoughts or comments?
I would just like to say thank you.
Yeah, thank you, Elizabeth. So I'll share the our training slide here so that you can, and I'll put you on the spot a little bit, Teresa, but this is our training tomorrow, and we're really pleased because it was based on a workbook that Teresa co-authored, but was the lead author on, and really provides, again, just like the ITCA toolkit for community health assessment, includes a lot of worksheets and templates and asks some really good questions to get you to think and reflect more deeply. And so I don't know, Teresa, if you want to just do a quick PSA for the workshop tomorrow.
Sure. Yeah, no, I appreciate that. And I agree with what you said. It really came out of, we worked actually with 2 tribes and their tribal programs on an implementation and technical assistance plan because they had been trained in the 5 A's, but just weren't implementing it. So we really wanted to get to the root of why, right? That happens. How often do we get trained in something and then we don't put it into use? And so this workbook actually came out of that question. We worked with those tribes. A lot of the activities that are in the workbook came from activities that we use to educate ourselves, to educate the people working in the programs. And then also that loop of feedback. We got their feedback about what was working, what wasn't working, what could we change, what tools do we need to provide so that we feel ready and comfortable to implement an intervention like the 5 A's. And so, yeah, we're really excited. Just recently, we were cited in CDC's best practices, tobacco where you live in Native communities. And so, yeah, we're really excited to share this workbook. It's free to download. And yeah, we'll have more information tomorrow. So if you're interested or if you have colleagues interested, tomorrow, same time, 10 a.m. Central.
So with that, if there aren't any other questions or comments, we'll go ahead and turn it over to Mary Frances to wrap up.
Thank you. I did want to add that looks very interesting, and maybe some people aren't specifically interested in tobacco, but just to add a plug, 5 A's is a Lean Six Sigma tool. So I think it's really important to learn the process of doing things and then learning how to implement it in your own subject area. So sounds like a very interesting training, and looking forward to it. Thank you, Lena. Thank you, Teresa, for a wonderful presentation. I hope everyone got to learn a lot. I know I did. And if everyone could please remember to fill out the evaluation. There's a session evaluation. It's if you can log on to your CVent, go ahead and log in with your credentials. And on the right-hand side, there's actually now a button that says survey. You can just click that. And then it has another little button that says take the survey, and you could see the session specific survey for this one. So we appreciate any and all feedback. And I hope everyone enjoys the rest of the training summit.
Thank you, everyone. Have a good evening. Good afternoon.
15 minutes back in your day.
Yeah.
Thanks, everyone.
Thank you.